As I mentioned, my good friend, Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, joining us on this Wednesday morning. Dr. Joe, what's on your list for us today?
Ray, how you doing? I want to talk a little bit about foot injuries, the most common foot injuries I'm going to talk about. And do we still use orthotics a fair bit? We used to talk about orthotics a lot, foot inserts, prefab, ones that, are already made or ones that are made permanently. Where are we with those? So I called a couple of my good friends in town that are foot specialists and foot therapists, and to see the answer to that. It's changed a little bit in the last decade or 15 years. We used to use orthotics, so much, even for knee injuries and hip injuries and back injuries to try to get the gait and alignment back to normal. Not used as much in those areas, but still were used very much in foot injuries. And I got the idea, too. I was listening to Joe Burrow in an interview, and he was saying he's kind of frustrated with the orthotic that he has to wear for his turf toe, and he doesn't look totally comfortable yet with that orthotic, and watching a little bit of his game. I've got to admit, I think Darius Garland probably not fully comfortable yet either. He had the surgery done for the turf toe. Turf toe's a big deal, but it's not that common. And I want to talk about the three most common and orthotics with these. In kids, a career for me of seeing young athletes, 30 to 40% of kids who play a lot of sport get a thing called Seaver's disease. That we have talked about here a lot. There's a growth plate in the foot. After a few weeks or months of playing, they're limping around, they're having pain all the time. When the pain, you try a few things and they're not getting better at the end of a month or 6 weeks, that's when we used to say, hey, we probably ought to bring them in and start looking at them and some things we could do to try to get them better with Seaver's disease. And orthotics are a part of helping young kids get better. This happens in the pre-high school kids who still have open growth plates. In the foot, there's 28 little bones, a lot of bones in the foot. And there's 20 what are called intrinsic muscles. And these little muscles, intrinsic muscles in the foot, are for shock absorption, explosion in sports, and to maintain the arch. And what happens is, for so many years in sports medicine, and so frustrating for me, people didn't address the muscles at all. They wanted to address massage and cross-training and bracing and putting people in a boot or a cast and things. They didn't do the rehab. And what's changed the most is we work on those 20 intrinsic muscles and get them strong so we get back to the shock absorption and explosion. You've got to work on those muscles. The second real common one, we had a couple of really high-level cross-country runners this year that made it down to state, that got up on the stand at the end, in the top 2 or 3 runners in the state of Ohio, that had the very, very common injury in runners, dancers, ballerinas, is the stress fracture of the foot. And the stress fracture of the foot is number 2 to just shin in the second most common stress fracture. And when we get into this area, we add, our foot specialists in physical therapy get back to the strengthening of those muscles. They might benefit from an orthotic for sure, a lot of these runners. Before we put an orthotic in and make one for them, we want an experienced person to look at the gait analysis of how they run, because then we can adjust the orthotic for the specifics of the runner to get back to that shock absorption and to get them running normally again. Remember one more thing, little pearl. If these kids are getting recurrent stress fractures, we might need to check them and get them into the sport medicine clinic to look for bone density issues. It is pretty common as we have recurrent stress fractures to have low bone density, and we might need to address that as well with supplementation and follow-up. And number 3 in the adult world, so common. Every gym I go to, Ray, and I'm all over town in different gyms, people who either have the symptoms of, or they tell me their doctors and therapists or orthopedists are telling them they have plantar fasciitis. 30 to 40% of active adults get plantar fasciitis. It's just so common. They're trying to do a great thing by, here we are in the winter, I'm trying to stay in shape, I'm getting on the treadmill, and the next thing you know, they're limping around, they're in a boot, they're in a cast sometimes still because they've had the pain so long. That's the worst thing. These 20 muscles will go on vacation and get weaker and weaker. And some people, 6 months later, I see them, and they're still having foot pain, and they're still in a boot, and it's just not right. They need to get into physical therapy. If it gets past a month or two and you're still having foot pain as an active athlete, you need to get in. And we have in our area several people that are specialists. I talked to a couple of them yesterday in preparation for this. My favorite that I've worked with for 25 years, Amy Cray, is out at the Pinnacle Sports Medicine and Physical Therapy place. She's 25 years where most of her patients are foot and ankle, and she just really they have a really good way of looking at your gait analysis and looking about what orthotic is going to help you the most, and how do you strengthen those tiny muscles that give you shock absorption and maintain your arch. So physical therapy becomes the real key. So don't just limp around all winter. Don't give up on these things. If you get past 6 weeks with fevers, probably time to get in to see a pediatric sports medicine person. If you get past a month or two as an adult athlete with foot pain and you're limping around, time to get in and get some physical therapy done. It's not usually, in most cases, a surgical problem. It's a rehab problem, and we need to get the strength back in that foot.
Well said. Joe, as always, my friend, good, timely, great insight into the world of sports medicine. Thank you, Joe.
Thanks, Ray. Talk to you next week.
You got it. Dr. Joe Congini with us, Sports Medicine Center, Akron Children's Hospital, part of this show for over 30 years. Really good insight and timely information on sports medicine.